is a vital function of the Secretary of State to deal with health emergencies.
Absolutely. And going into the job, I had some experience at a more junior level of dealing with crises and emergencies, and so I took my responsibilities as the principal responder to a pandemic very seriously.
Does dealing with health emergencies include dealing with infectious diseases?
Yes, of course.
And being ready to deal with them? Being ready to deal with the risk of infectious diseases?
Absolutely. I was already aware of this element of the role from my time at the Cabinet Office, but nevertheless it was properly and formally brought to my attention. And on day one, I asked for more information on preparedness because having been involved in previous crises, for instance, at the Bank of England before I went into politics, I knew that when things go wrong, things move quickly, and you need to be as well prepared. So when I joined the Cabinet Office with responsibility for that area, a significant piece of work had just been concluded, which had been led by Oliver Letwin. I, of course, was aware of and read those documents at the time, but then was not aware of the next iteration of that work going on. And as you say, there wasn't a publication in that area for a number of years. And in any case, the language in those documents as they were revisited over the years was essentially the same, which is that the Category 1 top risk was of a pandemic influenza, and then there was also consideration of other infectious diseases and external threats. And I know there's been significant discussion so far at the inquiry of the focus on influenza pandemic. I was told that the reason that was the Category 1 risk is because it's the most likely pandemic. But of course we were aware of other infectious diseases, not least because we were actively involved in responding to Ebola and to a lesser extent Mpox, and PHE had a day-to-day responsibility for other infectious diseases that tend to happen in much smaller numbers, like Legionnaire's disease. So I was aware of it both from the work in the formal production of those risk assessments and in the day-to-day work of the department. Because I was assured that the UK planning was among the best, and in some instances the best in the world. And of course, with hindsight, I wish I'd spent that short period of time as Health Secretary before the pandemic struck, also changing the entire attitude to how we respond to a pandemic. And perhaps, one of the reasons that I feel so strongly about the importance of this inquiry and why I'm so emotionally committed to making sure that it's a success with full transparency and total brutal honesty in answering your questions to get to the bottom of this is because this huge error in the doctrine that the UK, and by the way, the whole Western world had in how to tackle a pandemic. And that flawed doctrine underpinned many of the problems that made it extremely difficult to respond. And if I may say so, I am profoundly sorry for the impact that had. I'm profoundly sorry for each death that has occurred. And I also understand why, for some, it will be hard to take that apology from me. I understand that. I get it. But it is honest and heartfelt. And I'm not very good at talking about my emotions and how I feel. But that is honest and true.